In this video, I want to be helping you to really understand your knee. We're going to talk what all of the structures of the knee are, what they might feel like, what their roles are. So we're going to be talking quadriceps or patella tendon. We're going to be talking about the meniscus or the cartilage in the knee. We're going to be talking about NCLs, ACLs, PCL, so they're the cruciate ligaments at the back there. We're going to touch upon things like Osgood-Schlatter and arthritis as well. And using this kind of broken up model, we're going to really rip this knee apart so that you can dive in and see all of the details that you need to help to understand your knee fully. So let's dive right in. Now, firstly, if you followed my content, something that you'll know about me is that I often talk about the knee being the joint that gets a lot of bad press, a lot of bad media, but it's so often not the knee's fault. So it's a structure that lives in the middle of our lower limb and can be greatly affected by the structures above it being the hip and below it being the ankle. And often our role as sports therapists is to really start to understand what's causing the problems at the knee. But in this video, I want to talk about the structures of the knee to help you really understand. So first of all, we have this big tendon coming over the top of the knee, and this is generally termed the patella tendon. Sometimes it can be broken down into two, and we have the quadriceps tendon, and the patella tendon as two parts, but effectively it's one big structure that comes across the top of the knee. Now, its role is to act as a tendon. Tendons are something that join muscles to bones in order to create movement at the joint. So in this case, this is our quadricep tendon. So we have our big quad muscles on the front of the leg, or our thigh muscles, and they all attach into this tendon that crosses over the top of the knee and attaches onto here. So that when we contract those muscles, it creates this knee extension. So we're using these quad muscles a lot, running, jumping, kicking, striking, all these types of things that we might be doing uses those a lot. So if we feel in pain that feels like it comes across the top of the knee and pulls down onto the attachment point, this attachment point here is something called your tibial tuberosity, so right at the top of the shin bone. So if you feel a pain running across the top of your knee, particularly we might find when we're walking up, or most in particular downstairs, if you feel that pulling sensation across the top of the knee, that's something that might be going on here. And that's where we want to start addressing the quadricep muscles and things. But we have lots of videos on our channel about all these different conditions. So in this video, I don't want to dive into particular ways of helping these, but if you think that any of this resonates with you, dive into the rest of our channel where we'll have some videos about them. So that's the patella tendon living over the top. And actually, if we start to rip this kneecap away here, then we can get into some of the deeper structures of the knee. So firstly, we've got these blue structures here. Now, this is what we call the meniscus, the medial meniscus. Medial means inside, and the lateral meaning outside meniscus. And now these discs. Now, really their role is to make the knee move nice and smoothly over each other. We can see that this top bone here, this femur, we often talk about being a dog bone because it has these sort of end of a dog bone type look to it, and that sits on this flat tibia here, and we sometimes call that the tibial table because the top of this is nice and flat. So they're not great surfaces at working together, but what we have are these discs in here, these circular discs of cartilage that act as this smooth layer. They're also really good at absorbing shock through the knee, so there are shock absorbers in the knee. But what we can typically get is some tears in this, some degeneration in this, and that might make itself known by things like clicking or locking of the knee, where the knee's not able to smoothly go over the top of each other. So in clinic, what we like to do is try to grind these bones against each other to see if we actually get that painful response. And then we might know that we're catching a problem in that meniscus. So if you're suffering with things like clicking or locking of the knee, or something where your knee just doesn't feel like it's moving smoothly, then that might be worth checking out that meniscus living in there. Now, let's move on to talk about some of the collateral ligaments. Now, collateral ligaments are ligaments that live on the side of the joint and really look to keep the joint moving in a nice straight line and prevent too much sideways movement. So perhaps the more common one to be injured is what we call the MCL. That stands for medial collateral ligament, remembering that medial means it lives on the inside of the knee. So again, when we're testing this, we start to try and pull the knee apart to stretch this one. And these ligaments are typically damaged with twisting type movements or impact starts movements where we jolt the leg. So if you have a jolt at the leg, we can damage this. And this is particularly known when we feel pain right running down the inside of the knee. So very much off of the straight aspect of the knee and we go on to the inside of the knee, where we might actually be able to feel the bony, what we call the condyle here, the inside bit of the knee, the bony bit. If you're feeling pain right around the inside of the knee, then we would want to be checking out that MCL. And then flipping to the other side, we have the slightly smaller ligament, but this is our LCL, our lateral collateral ligament. Remember, lateral meaning on the outside or away from the midline. So very similar to the MCL in its role, it's just kind of doing the opposite really. So again, jolting of the knee, twisting of the knee, and we can start to damage that lateral collateral ligament. Now, moving on to one that you might be familiar with because it gains a lot more media attention. I don't want to say fashionable because this really isn't one that anybody wants, but it's quite common amongst the media, is what we call our cruciate ligaments. Now, the cruciate ligaments, we've got two of them, the ACL and the PCL, anterior cruciate ligament, posterior cruciate ligament. Anterior meaning the front and posterior meaning the back. So, but both of them live in the back of the knee here, and they form, the cruciate refers to the cross. They cross over ligaments and they're a major player in stabilizing our knee. So unfortunately, these injuries become quite apparent. One, because they take a long time to heal. And secondly, because they are common in sports with twisting. So if we think of something like football, and what you'll see is somebody perhaps having the lower part of their leg fixed while the upper part rotates. So another common cause of this could be something like skiing, where the foot can be trapped and it's fixed in the boot and the upper body rotates, so the leg rotates on top. And then you might not be able to see here, but this one here has a broken cruciate ligament at the front there. So that's the ACL, and that's by far the most common. And so what happens then, unfortunately, is we get this rupture, and typically, not always, but it requires a surgical intervention in order to fix that. But there's lots of decision making that go into that process around lifestyle choices, what we're looking to achieve. So if you do fear any sort of ACL issues, one is definitely one you want to be getting checked out, and two, check out some of the other videos on my channel around the ACL where I talk in a little bit more detail. But how that would typically feel, again, it's a very distinct mechanism of injury. So people generally know when they have a problem when this happens. So they feel that rotation, they might feel a click. It's common to hear an audible noise. We tend to get lots of swelling around the knee, becomes very uncomfortable to move. A therapist or a medical practitioner would look to do a test where they look to glide the lower leg on the upper leg. And what's happening here is we're just checking with whether the ACL is intact. Because if it's intact, it gets blocked. But actually, if we start to be able to move it quite far, we know that there might be a slight issue with the ACL there. So again, a very common one. But one that we want to avoid where possible. So we've got the quadriceps tendon, we've talked about the meniscus, we've talked about the MCL, the LCL, and the cruciate ligaments. Some other ones that perhaps aren't directly related to this structure, but can certainly manifest itself with knee pain. One being ITB Friction Syndrome, or runner's knee. Again, super common in the endurance type world. So long distance running, cycling, sports where we're doing the same type of movement over and over again. Because what happens is we have this big structure called an ITB. Again, lots of videos on my channel around this one, but it's a band of fascia that runs down the outside of the leg and it goes bang into this head of the fibula. Attaches right onto the head of the fibula being the smaller of our lower leg bones. And so what happens is it can rub and it can disturb this. So if you're feeling, and you can feel the head of the fibula by feeling the outside of the knee, if you're getting a pain right around that point, very much worth checking out that ITB. And again, getting that one checked out, because it's an overused condition that unfortunately will only get worse as time goes on if it's not corrected. And then the other ones to mention, Osgood-Schlatter is a pain around the tibial tuberosity, the bit I mentioned earlier where the big tendon attaches into. This is far, far more common in the growing athlete because this part, the tibial tuberosity, actually isn't turned to bone yet, and it's a softer structure called cartilage. So if we pull away a lot and do lots of running and kicking and things, we can get a disturbance of that growth plate there, that pain. But again, a more detailed condition where there's lots and lots of information on my channel. So if you're worried about that one or want more information on that one, just type in Osgood-Schlatter into my channel and it'll be able to help you out. And then the final thing probably is arthritis, a common one, unfortunately, a condition of degeneration. Super common to have this. all of our layers of the bones have what we call cartilage or hyaline cartilage that allows to help them rub nice and smoothly. But unfortunately, that can degenerate over time. It can flake, and then we start to feel this kind of bone on bone happening. And what happens then is we get a lot of soreness, perhaps heat, inflammation around the area. And what we really want to do is then be trying to understand what's causing that extra pressure around the knee so we can correct that and ultimately limit the symptoms. We're probably not going to reverse those symptoms, but we can look to try and manage those as we want to dive through into our exercise goals. But again, I've got a video on that on my channel, so I've got you covered if you want to check out any of these things. But what I wanted to do in this video was literally rip this knee apart, show you everything in action here and how they might be working so you can get a greater understanding of the structures of the knee and really start to let you know how these conditions might feel, or if you're worried about any knee pain, it might point you in the direction of what might be causing it. But ultimately, as ever, if you're getting knee pain, you want to get that checked out. Find a healthcare professional, but feel free to mention some of the points raised in this video because that might help them to answer any of the queries that you may have. And ultimately, you want to get these rehabbed nice and correctly so that you can dive straight back into your health and well-being journey. And speaking of health and wellness journeys, have you subscribed to our channel? Because here at this channel, I'm looking to do the 3 simple things of getting you to understand your body better so you can strive forward and hit your health and well-being goals and ultimately be pain-free. So if that sounds like a journey you want to be on, hit that subscribe button and I will be thrilled to take you with me. Here's another video, and if you haven't liked this one and you've made it this far in the video, smash the like button because that shows me I need to be making more stuff just like this. See you on the next one.